holoprosencephaly. 17 or 20. A 20-year-old man presents with swelling around his left eye. A CT scan shows a high attenuation mass lesion which expands the ethmoid air cells with bony erosion. There are small punctate calcifications seen within the mass. On MI, the mass returns low signal on T1 and T2. The most likely diagnosis is A. Fungal sinusitis. Callosal agenesis is associated with Dandy-Walker syndrome, Chiari malformations and fetal alcohol syndrome. 17. A. Fungal sinusitis. CT findings are typical, showing a hyperdense lesion with calcifications and bony erosion. The ethmoid sinus is most commonly involved and bony expansion with erosion is characteristic. On MI, the lesion is low signal on T1 and T2 due to high fungal mycelial iron, magnesium and manganese from amino acid metabolism. CH06.int100 D. Juvenile angiofibroma, E. Chronic sinusitis. 18 or 15-year-old girl presents with symptoms of chronic sinusitis. CT of the paranasal sinuses shows a low-density mass opacifying the right maxillary antrum and extending to the posterior choana. No bony destruction is seen. The left maxillary antrum also shows mucosal thickening. The most likely diagnosis is A. Juvenile angiofibroma, B. Antrochoanal polyp, C. Fungal sinusitis, D. Inverted papilloma, E. Intranasal glioma. C. Answers 145. Answers 145. 18. B. Antrochoanal polyp. These are seen as low attenuating masses from the maxillary antrum extending through a sinus ostium to the choana. They show non-aggressive features with peripheral enhancement. MI shows a hypo to variable signal on T1 with hyperintense on T2 with peripheral enhancement. Juvenile angiofibroma is seen in adolescent males with an intensely enhancing mass extending to the posterior nasopharynx. Inverted papilloma are seen in older males as a locally aggressive mass of the middle meatus extending into the maxillary sinus. Intranasal glioma usually present at birth as a very soft mass centered at the nasal dorsum. 19. A. Cavernous hemangioma. This is the most common orbital mass in adults and is the most common vascular malformation of the orbit. CT demonstrates the location of the lesion and CH06. 130 of March 2010 10:35 and 31 seconds AM. Questions 131. 19. A 25-year-old man presents with painless progressive proptosis. CT shows a soft tissue lesion with microcalcifications in the left orbit. On MI, T1 axial and coronal images show a soft tissue mass isointance to adjacent muscles in the extraconal plane while the T2 images show the hyperintense septated lesion. The lesion avidly enhances with gadolinium. What is the most likely diagnosis? A. Cavernous hemangioma. B. Orbital pseudotumor. C. Neurofibroma. D. Dermward cyst. E. Hemangioparasitoma. Microcalcifications. Remodeling of the bone may be seen. MI features are typical as given. 20. A. Schwannoma. Hemangioparasitoma. 20. A 50-year-old woman complains of tinnitus, headaches and hearing loss. MI shows a heterogeneous, well-defined mass in the left cerebellopontine angle producing a local mass effect. The lesion returns low signal on T1, heterogeneous high signal on T2 and heterogeneously enhances with gadolinium. The most likely diagnosis is A. Schwannoma. Vestibular schwannomas are the most common cerebellopontine angle tumors with typical imaging features as given above. These are typically benign, slow-growing tumors from Schwann cells which envelop and myelinate cranial, spinal and peripheral nerves. In the skull, they most commonly arise in the cerebellopontine angle, from the vestibular portion of the 8th cranial nerve. The main differential diagnosis is meningioma, which can also grow from the 8th cranial nerve. A schwannoma is hyperintense on T2 while a meningioma is ISO hypointense. Also, a meningioma forms an obtuse angle with the petrous bone while a schwannoma forms an acute angle. Finally, a meningioma may have a dural tail, which is absent in a schwannoma. 21. A 9-year-old boy presents with precocious puberty and headache. CT of the brain shows an enhancing mass in the pineal region with calcifications. There is moderate hydrocephalus with a dilated lateral and third ventricle. The most likely diagnosis is A. Pineal germinoma. B. Glioma. C. Medulloblastoma. D. Meningioma. E. Metastases. CH, while a schwannoma forms an acute angle. 21. 21. A. Pineal germinoma, also called pinealoma. This is the most common pineal tumor and is associated with precocious puberty in children less than 10 years old. The finding of pineal calcification before 10 years with a pineal mass enhancing with contrast is usually diagnostic. Hydrocephalus is secondary to compression of the cerebral aqueduct. Medulloblastoma is a tumor usually in the posterior fossa and presenting in childhood. Suprasellar meningioma does not arise from the pituitary fossa. (132) Central nervous system and head and neck. 22. A 30-year-old man presents with loss of sensation in his toes. MI of the cervical spine shows cerebellar ectopia of 4 mm below the foramen magnum and syringomyelia of the cervical cord. The most likely diagnosis is A. Chiari malformation. B. Chiari 2 malformation. C. Chiari 3 malformation. D. Chiari 4 malformation. E. Dandy-Walker malformation. Childhood. Suprasellar meningioma does not arise from the pituitary fossa. 22. A. Chiari malformation. Chiari malformation is characterized by cerebellar ectopia and is frequently an isolated hindbrain abnormality without supratentorial abnormalities. 20–30% of cases are associated with syringomyelia. 23. A 13-year-old child with a history of perinatal infection presents with headaches and vomiting. CT of the brain shows gross dilatation of the lateral and third ventricles with a normal fourth ventricle. No tumor masses are seen. The most likely diagnosis is A. Aqueduct Stenosis, B. Klippel-Feil Syndrome, C. Chiari Malformation, D. Dandy-Walker Malformation. A. Aqueduct stenosis. There are various causes for aqueductal stenosis, however the imaging features of this condition are dilated lateral and third ventricles with a normal fourth ventricle. This is the most frequent cause of congenital hydrocephalus. Its etiology may be classified as post-inflammatory, commonest, congenital or neoplastic, rare. 24. B. Astrocytoma. E. Neurofibromatosis. 24. A 32-year-old man with a 3-month history of headaches presents to the accident and emergency department with tonic-clonic seizures. MI shows a 5 cm intra-axial lesion in the left frontal lobe. The lesion appears hypointense on T1 and hyperintense on T2 to brain parenchyma. No significant surrounding edema is seen and there is no enhancement with gadolinium. The most likely diagnosis is A. Oligodendroglioma, B. Astrocytoma, C. Arachnoid cyst. 24. B. Astrocytoma. These MI appearances are typical of a grade 2 astrocytoma. Grade 3 are more infiltrative and show more surrounding edema. Oligodendroglioma show calcifications. Arachnoid cysts show CSF density on all sequences. Metastatic lesions and lymphoma enhance with gadolinium. 25. Questions 133. 25. A 35-year-old man presents with headache and ataxia. CT of the brain shows a 6 cm cystic lesion in the right cerebellar hemisphere with a small enhancing nodule at the margin of the cyst. The most likely diagnosis is A. Arachnoid cyst, B. Necrotic metastasis, C. Hemangioblastoma, D. Juvenile pilocytic astrocytoma, E. Cysticercosis. 25. C. Hemangioblastoma. This is the most common posterior fossa tumor in adults after metastases. They are usually seen in the cerebellum and there is an association with von Hippel-Lindau disease. CT appearances are typically with a large hypodense cyst and an enhancing mural nodule. The cyst wall does not usually enhance. On MI, flow voids may be seen representing draining vessels adjacent to the nodule. Juvenile pilocytic astrocytoma is seen in young age and is not associated with feeding vessels. Metastases are usually multiple in older people. 26. B. Neurocysticercosis. 26. A 20-year-old immigrant from South America presents with seizure. CT of the brain shows multiple cystic lesions, with some of them showing calcification. On MI, there are multiple fluid-containing cysts in the brain, some of which contain small nodules. There is mild surrounding edema. The most likely diagnosis is A. Multiple brain abscesses, B. Neurocysticercosis, C. Tuberculomas, D. Metastases, E. Sarcoidosis. 27. A 60-year-old man, feeding vessels. Metastases are usually multiple in older people. 26. B. Neurocysticercosis. This is the most common parasitic infection of the brain and is particularly prevalent in South America, Asia and Africa. In the vesicular stage, CT and MI show multiple, thin-walled cysts containing skelects with minimal surrounding edema. E. Sarcoidosis. 27. A 60-year-old man with a history of chronic alcoholism is admitted with confusion and dysarthria. MI shows a 2 cm area of abnormality in the central pons which returns high T2 signal and low on T1. There is a rim of normal tissue around this lesion and prominence of the cerebellar folia. What is the most likely diagnosis? A. Multiple sclerosis, B. Central Pontine Myelinolysis, C. Infarction, D. Neoplasm, E. Acute disseminated encephalomyelitis, edema. 27. B. Central Pontine Myelinolysis. This is characterized by a symmetrical, non-inflammatory demyelination of the basis pontis. The underlying cause is rapidly corrected hypernatremia. MI appearances are characteristic with a sparing of peripheral rim of tissue. The corticospinal tracts are generally spared as well. A 28-year-old unconscious man was admitted to the accident and emergency department after a motorcycle accident. He briefly regained consciousness and then started to decline again. CT of the head shows a fracture of his right parietal bone over a lentiform extra-axial hematoma with midline shift. What is the most likely diagnosis? A. Subdural hematoma. B. Extradural hematoma. C. Subarachnoid hemorrhage. D. Meningioma. E. Intraparenchymal bleed. Pontis. The underlying cause is rapidly correct. Are generally spared as well. 28. B. Extradural hematoma. Classically, an extradural hematoma is seen as a lentiform /biconvex hyperdense collection bounded by cranial sutures and associated with skull fracture. The collection may be heterogeneous if active bleeding is occurring. 29. A 9-year-old boy with inguinal freckling presents with visual problems and epilepsy. MI shows homogeneous enhancement of bilaterally enlarged optic nerves. What is the most likely diagnosis? A. Neurofibromatosis type 1. B. Neurofibromatosis type 2. C. Tuberous sclerosis. D. Von Hippel-Lindau disease. E. Sturge-Weber syndrome. CH06. Ind 146 8th of March 2010 10:35 and 32 seconds AM. Answers 147. 29. A. Neurofibromatosis type 1. This is the most common type of neurocutaneous disorder. Common lesions encountered include café or late spots, peripheral nerve neurofibromatosis, optic nerve glioma, iris hamartoma, axillary and inguinal freckling, bony abnormalities, pseudarthrosis, scoliosis and duct ectasias. It is also associated with malignancies including astrocytoma, malignant nerve sheath tumors, Wilms tumor, rhabdomyosarcoma, leukemia, thyroid carcinoma and pheochromocytoma. 30. B. Carotid body. Syndrome. 30. A 40-year-old hypertensive woman presents with a neck mass. A left carotid angiogram demonstrates an intensely enhancing mass splaying the carotid bifurcation. What is the most likely diagnosis? A. Metastasis. B. Carotid body paraganglioma. C. Lymphoma. D. Branchial cyst. E. Carotid dissection. CH0. Body paraganglioma. Carotid body tumors are the most common extracranial head and neck paraganglioma. These typically splay the internal and external carotid arteries because they arise from the tissue located at the carotid artery bifurcation. They demonstrate an intense and persistent vascular blush on imaging. The combination of intense blush with flow voids on MI has been described as a salt and pepper appearance. These tumors may be familial and multicentric and are malignant in 10% cases. 31. CH06. Ind 134 8th of March 2010 10:35 and 31 seconds AM. Questions 135. 31. A 18-year-old man was admitted after a road traffic accident. CT of the head shows an incidental lesion in the right cerebellopontine angle. MI shows a 4 cm homogeneous lesion in the right cerebellopontine angle which is high signal on T2, intermediate on T1 and without restricted diffusion. No gadolinium enhancement seen. What is the most likely diagnosis? A. Arachnoid cyst. B. Acoustic neuroma. C. Epidermoid cyst. D. Lipoma. E. Necrotic metastasis. (31) A. Arachnoid cyst. An arachnoid cyst returns signal characteristics of cerebrospinal fluid. High on T2, intermediate on T1 and no restriction on diffusion-weighted images. 32. C. Oligodendroglioma. These tumors are seen in metastasis. Metastasis. 32. A 42-year-old man presents with increasing headache and blurred vision. CT of the head shows a large lesion in the periphery of the left parietal lobe with extensive calcification. The lesion shows heterogeneous contrast enhancement. There is a mass effect with midline shift. What is the most likely diagnosis? A. Ganglioglioma. B. Calcified arteriovenous malformation. C. Oligodendroglioma. D. Pilocytic astrocytoma. E. Meningioma. In young adults and are usually located in the peripheral cerebrum. They typically begin in the hemispheric white matter and grow towards the cortex. They are well circumscribed but non-encapsulated. Calcification is a common feature. A 21-year-old boy with neurofibromatosis type 1 complains of visual difficulties. MRI shows abnormal enlargement of the optic chiasm and intense and homogeneous enhancement with gadolinium. The abnormality extends into the left optic tract. What is the most likely diagnosis? A. Craniopharyngioma. B. Lymphoma. C. Neurosarcoidosis. D. Chiasmoglioma. E. Tuberculosis. 33. D. Chiasmoglioma. Chiasmoglioma is associated with NF1 in 15 to 25% cases. Craniopharyngioma tends to displace the chiasm rather than enlarge it. It is often cystic and may show calcification. Lymphoma is more likely to involve peripheral nerves. Tuberculosis may involve the chiasm but in the setting of basal meningitis, leptomeningeal enhancement and multiple cranial neuropathies. CH06.135 the 8th of March 2010 10:35 and 31 seconds AM. 136 Central nervous system and head and neck. 34 A 75-year-old woman presents with sudden onset left homonymous superior quadrant anopia. Head CT shows a subtle hypointensity in the right medial occipital lobe. On MI, the occipital region shows high signal on FLAIR. Diffusion-weighted images show high signal in the right medial occipital lobe consistent with reduced diffusion. What is the most likely diagnosis? A. Acute occipital lobe. Lobe infarct in posterior cerebral artery territory. B. Occipital lobe tumor. C. Hemorrhage. D. Old occipital lobe infarct. E. Acute occipital lobe infarct in middle cerebral artery territory. Neuropathies. 34. A. Acute occipital lobe infarct in posterior cerebral artery territory. Homonymous visual field defects result from retrochiasmal lesions, which include the optic tracts, lateral geniculate body, optic radiations and visual cortex. Unilateral posterior cerebral artery infarction results in isolated hemianopia. The superior portion of the visual field projects to the inferior occipital cortex. Thus, a partial or branch occlusion of the posterior cerebral artery may lead to an isolated superior or inferior visual field defect. Territory. 35 A 25-year-old man presents with unilateral proptosis, chemosis, reduced visual acuity and a bruit over his right orbit. Gadolinium enhanced MI of the orbits shows abnormal contrast enhancement of the right periorbital soft tissues and extraocular muscles. The superior ophthalmic vein is also dilated. What is the most likely diagnosis? A. Carotid cavernous fistula. B. Graves' disease. C. Orbital pseudo. 35. A. Carotid cavernous fistula. Important imaging findings include extraocular muscle enlargement, proptosis, chemosis and dilatation of ipsilateral cavernous sinus and superior ophthalmic vein. Graves' disease affects older ages and bilateral involvement is typical. An orbital pseudotumor is a non-specific inflammation involving any area of orbit. Orbital bruit and a dilated superior ophthalmic vein are not usually seen. 36. D. Multiple sclerosis. MS typically produces multiple white matter lesions that are hyperintense on T2 and FLAIR. E. Cavernous hemangioma orbit. 36 A 35-year-old woman with spastic paraparesis presents with an episode of right facial paralysis. FLAIR axial images show multiple foci of hyperintense signal in the periventricular distribution, aligned at a right angle to the ventricles. Contrast-enhanced T1 images of cervical spine show multiple enhancing lesions in the cervical cord. What is the most likely diagnosis? A. Diffuse axonal injury. B. Small vessel ischemic change. C. Vasculitis. D. Multiple sclerosis. E. Neurosarcoidosis. And FLAIR. Characteristically, these lesions are aligned at right angles to ventricles. Contrast enhancement may be seen in active lesions. A 40-year-old man presents with unilateral sensorineural hearing loss. MI shows a well-defined mass in the left cerebellopontine angle. The lesion returns high signal on T1, T2 and FLAIR sequences. On fat-saturated T1 with contrast, the lesion returns low signal and no contrast enhancement is seen. What is the most likely diagnosis? A. Acoustic schwannoma with hemorrhage. B. Lipoma. C. Epidermoid cyst. D. Giant aneurysm. E. Arachnoid cyst. 37. B. Cerebellopontine angle lipoma. The lesion has characteristics of fat on all sequences, high signal on T1 and T2 with loss of signal on fat suppression imaging. 30. Arachnoid cyst. 38. A 52-year-old man with a history of previous treated arteriovenous malformation in brain presents with bilateral sensorineural hearing loss. MRI of the brain shows that the contours of brain outlined by hypointence rim on T2 and T2 * GRE images. What is the most likely diagnosis? A. Central nervous system siderosis. B. Mr. C. (38) A. Central nervous system siderosis. Recurrent subarachnoid bleeds cause hemosiderin deposition on the surface of the brain, brainstem and leptomeninges. This is seen as hypointence signal on T2 and T2 * GRE images. (39) A 70-year-old man was admitted with left-sided hemiparesis. Brain CT shows an area of low attenuation in the right lentiform nucleus. Which of the following artery is involved? A. Anterior choroidal branches. B. Posterior cerebral artery. C. Lateral lenticular striate branches of the middle cerebral artery. D. Medial lent. (39) C. Lateral lenticular striate branches of middle cerebral artery. The basal ganglia derive their blood supply from the lenticular striate arteries. A portion of the anterior limb of internal capsule and the head of caudate nucleus is supplied by the medial lenticular striate arteries. The lateral lenticular striate arteries supply the lentiform nucleus and parts of the caudate nucleus and internal capsule. A 65-year-old diabetic woman presents with dysarthria and right-sided weakness. CT shows loss of gray-white matter differentiation in the left parafalcine cortex of the frontal lobe. The arterial territory involved is A. Anterior cerebral artery. B. Middle. 40. A. Anterior cerebral artery territory. The parafalcine cortex of the frontal lobe is supplied by the branches of anterior cerebral artery. (41) A 42-year-old man presents in the accident and emergency department with epileptic seizure. Head CT shows asymmetrical white matter edema in the left parietal region with a mass effect. Post-contrast study shows a large, irregular and peripheral enhancing lesion with a central area of low attenuation. What is the most likely diagnosis? A. Lymphoma. B. Metastasis. C. Glioblastoma multiforme. D. Toxoplasmosis. E. Cerebral abscess. 40. 41. C. Glioblastoma multiforme. These tumors are typically inhomogeneous on CT and MI, showing irregular areas of peripheral enhancement. Tumor necrosis is a hallmark of glioblastoma multiforme. (42) A 35-year-old man presents with persistent headaches. CT of the head shows a 3 cm homogeneous and hypodense mass with homogeneous contrast enhancement. The lesion resolved with radiotherapy. What is the most likely diagnosis? A. Glioma. B. Metastases. C. Lymphoma. D. 42. C. Lymphoma. This is seen not only in immunocompromised but also immunocompetent patients. On CT, the lesion is usually hypodense showing homogeneous enhancement. Resolution with steroids and / or radiotherapy is a characteristic finding of cerebral lymphoma. C. 43. A 42-year-old Caucasian woman presents with multiple fits. CT of the head shows multiple, small enhancing lesions in the cortical and subcortical areas. On MI, these lesions return low signal on T2 and hyperintense on post-gadolinium T1. What is the most likely diagnosis? A. Tuberous sclerosis. B. Calcifications. Calcifications. C. Melanoma metastases. D. 43. C. Melanoma metastases. The T2 shortening effect is attributed to the paramagnetic effects of iron and copper bound to melanin. 44. A 52-year-old man presents with headaches. Head CT shows a 4 cm extra-axial, homogeneous, hyperdense lesion which enhances avidly with contrast. There is hyperostosis in the adjacent part of frontal bone. What is the most likely diagnosis? A. Meningioma. B. Lymphoma. C. Metastasis. D. Glioma. E. Oligodendroglioma. 44. A. Meningioma. These tumors arise from the arachnoid cap cells of the arachnoid villi. 45. C. Pars flaccida cholesteatoma. This typically causes A 45-year-old man presents with deafness and left ear discharge. CT of the petrous and mastoids shows a soft tissue mass in the attic with erosion of the scutum. No contrast enhancement is seen. What is the most likely diagnosis? A. Glomus tympanicum. B. Pars tensor cholesteatoma. C. Pars flaccida cholesteatoma. D. Cholesterol granuloma. E. Congenital cholesteatoma. Causes erosion of the scutum, ossicles or the lateral epitympanic wall. Pars flaccida is a small superior portion of the tympanic membrane. Scutum erosion is common and 3/4 of cases may have erosion of the ear ossicles. A 52-year-old woman presents with hearing loss in the right ear. Examination reveals a non-pulsating, bluish discoloration of the eardrum. CT shows a smooth expansile mass lesion in the middle ear which bulges the tympanic membrane laterally. On MI, the lesion returns high signal on T1 and T2 sequences. What is the most likely diagnosis? A. Cholesterol granuloma. B. Chronic otitis media. C. Glomus jugulaire. D. Cholesteatoma. E. Hemorrhagic otitis media. 46. A. Cholesterol granuloma. This is caused by recurrent hemorrhage into the middle ear cavity forming an inflammatory mass of granulation tissue. Diagnosis is made by demonstration of bony expansion on CT and high signal on T1 and T2. 40. A 27-year-old woman with facial skin lesions presents with chronic hearing loss in the right ear. CT shows expansion of the petrous and mastoid bones with a ground glass appearance. What is the most likely diagnosis? A. Osteopetrosis. B. Fibrous dysplasia. 47. B. Fibrous dysplasia. CT appearances are typical, showing increased volume of bone with ground glass appearance. 48. A 42-year-old woman presents with bilateral proptosis. CT of the orbits shows increased bulk of the rectus muscles and a dilated superior ophthalmic vein. What is the most likely diagnosis? A. Graves' disease. B. Orbital cellulitis with myositis. C. Orbital pseudotumor. D. Sarcoidosis. 48. A. Graves' disease. Graves' ophthalmopathy, thyroid eye disease, features bilateral exophthalmos with bilateral enlargement of the extraocular muscles. The condition particularly affects the inferior, medial and superior rectus muscles. 49. A 9-year-old boy presents with chronic right facial pain. Radiography shows an opaque right maxillary antrum. A CT scan of the paranasal sinuses shows that the right maxillary antrum is filled with soft tissue with destruction of medial and posterior bony walls. No significant sinus mucosal disease is seen in the other paranasal sinuses. What is the most likely diagnosis? A. Fungal infection. B. Allergic sinusitis. C. Rhabdomyosarcoma. D. Antrochoanal polyp. E. Acute sinusitis. 49. C. Rhabdomyosarcoma. Bone destruction suggests an aggressive lesion at this site, and rhabdomyosarcoma would be the most likely diagnosis in a young person. Questions 141. 50. A 40-year-old migrant worker of Chinese origin presents with a chronic history of nasal congestion and recent epistaxis. CT of the paranasal sinuses shows a large soft tissue mass in the postnasal space. There is also bony destruction with erosion of the basis sphenoid. What is the most likely diagnosis? A. Chronic polyposis. B. Juvenile angiofibroma. C. Nasopharyngeal carcinoma. D. Fungal infection. E. Pharyngeal abscess. Would be the most likely diagnosis in a young person. 50. C. Nasopharyngeal carcinoma. The lesion is aggressive with bony destruction and is likely to be malignant. Nasopharyngeal carcinomas have a high incidence in the Chinese population. It can feature bony destruction of the basis sphenoid, basiociput or the petrous tip. There may also be cranial nerve involvement, either at their exit through the foramina or secondary to intracranial extension. CH06.int149 8th of March 2010. Central nervous system. And head and neck. Chapter 6. Questions. 1. A 40-year-old man attends the accident and emergency department with acute onset of the most severe headache of his life. CT of the head demonstrates subarachnoid hemorrhage in the left sylvian fissure and early hydrocephalus. What is the most likely site of the ruptured aneurysm? Answers. 1. C. Left middle cerebral artery, MCA. Rupture of a left MCA aneurysm is likely to be seen as head. 2. A 30-year-old man presents with a lump in the left cheek. Ultrasound examination shows an 8 mm hypoechoic and lobulated lesion with a hyperechoic center. The most like 2. B. Lymph node. Typical appearances of intraglandular lymph nodes are of a hypoechoic periphery with a fatty hyperechoic center. 3. A 50-year-old man presents with headaches. A CT of the head reveals a 3 cm extra-axial lesion in the posterior fossa adjacent to the tentrum. The lesion is isodence with brain on non-contrast CT and has small areas of calcifications within. The lesion enhances homogeneously with contrast. There is no surrounding edema in the brain parenchyma. The most likely diagnosis of the abnormality is A. Medulloblastoma, B. Meningioma, 3. B. Meningioma. These are all typical features of a meningioma. Medulloblastoma is a childhood infratentorial tumor which is usually 4. A 1-year-old child presents with precocious puberty and MI shows a suprasellar mass attached to the mammillary bodies with a thin stalk. The most likely cause is A. Hypothalamic hamartoma. 4. A. Hypothalamic hamartoma, also called hamartoma of the tuber cinereum. This is seen in children less than 2 years of age. Precocious puberty is due to luteinizing releasing hormone secretion. 5. A 40-year-old housewife presents with severe left L4 radiculopathy. 1 year ago she had a L4/5 discectomy. A gadolinium-enhanced MI of the lumbar spine was performed. 5. A. An enhancing epidural tissue at L4/5 compressing on left L4 nerve. 6. A 30-year-old man with a bimalar rash and learning difficulties was shown to have bilateral renal angiomyolipomas. The most likely diagnosis is 6. A. Tuberous sclerosis. The classical triad is adenoma sebaceum, mental retardation and seizures. Patients also commonly have bilateral renal angiomyolipomas. 7. A chronic alcoholic was admitted with dehydration, acute confusion and electrolyte imbalance. The patient was admitted and treated vigorously with intravenous fluids. The next day the patient went into a coma. MI shows a round abnormality in the central area of the pons which returns low signal on T1 and high on T2. T2. The most likely cause of the abnormality is E. Pontine Myelinolysis, also known as osmotic myelinolysis. This condition is seen in people with rapidly corrected hypernatremia with intravenous fluids. The rapid correction of sodium releases myelinotoxic compounds resulting in destruction of myelin sheaths. This is particularly common in alcoholics. 8. A 37-year-old man presented with a history of intermittent headaches. An enhanced CT scan of the head demonstrates a 1 cm, dense, round lesion in the region of the interventricular foramen. Mild hydrocephalus was also seen. On MI, the lesion returns high signal on T1 and T2 sequences. The most likely colloid cysts are seen in the region of the interventricular foramen and cause positional and intermittent obstruction, leading to hydrocephalus and headaches. The lesion is dense on CT and high signal on T1 and T2 sequences as they commonly contain. 9. A 15-year-old boy presents with a history of epilepsy and visual loss. A CT scan shows tram-tracture-reform cortical calcifications in the right parieto-occipital lobe. MI shows cortical atrophy in the region of calcifications. Post-gadolinium T1 demonstrate focally. 9. D. Sturge-Weber syndrome. This is characterized by angiomatosis in the meninges, face and eyes. Meningeal angioma result in cortical atrophy underneath due to hypoxia. Calcifications are seen in the underlying gyri and ipsilateral choroid plexus. Thickening is also seen. Retinal angioma can lead to retinal detachment. Focally enhancing leptomeninges and enlarged ipsilateral choroid plexus in the occipital horn. What is the most likely? 10. A 40-year-old man presents with gradually worsening symptoms of ataxia, nausea and vomiting. CT of the head shows a 2 cm cystic lesion in the cerebellum with an enhancing mural nodule. What is the most likely diagnosis? Detachment. 10. A. Cerebellar hemangioblastoma. Hemangioblastoma. These CT features are typical of this lesion. Metastases usually have ring-like enhancement or homogeneous enhancement rather than having a mural nodule. Cystic astrocytoma are usually 5 cm, show calcifications, thick-walled and have no enhancing mural nodule. An arachnoid cyst is a possibility if no enhancing nodule seen. 11. A 40-year-old teacher presents with a history of hearing loss in the left ear. Gadolinium-enhanced MI shows a non-enhancing lesion in the left cerebellopontine angle, CPA. The lesion is isointence to CSF on T1 and T2 sequences. On FLAIR imaging, the lesion shows incomplete attenuation of fluid signal and on diffusion-weighted imaging it returns a bright signal. This resembles CSF on non-enhanced CT. On MI, the lesion is isointence, or slightly hyperintense to CSF. Incomplete attenuation on flare and high signal on diffusion, suggesting restricted diffusion, concludes the diagnosis. Non-enhancement is the rule. 12. A 70-year-old man with chronic rheumatoid arthritis presents with recurrent episodes of dry eyes, mouth and bilateral parotid swellings. CT shows bilateral diffuse parotid swellings with punctate calcifications and heterogeneous contrast enhancement. MI shows diffuse cystic lesions within both parotids on STIR. The most likely diagnosis is A. Sjogren syndrome. Rule 12. A. Sjogren syndrome. An autoimmune condition causing salivary and lacrimal gland destruction. Destruction. The secondary type is 13. B. Achondroplasia. Classical questions 129. 13. A 14-year-old, short girl presents with back pain. Radiographs of the lumbar spine show reducing interpedicular distance when progressing down the lumbar spine. There is exaggerated lumbar lordosis and marked scalloping of the posterior vertebral bodies. E. Hurley Syndrome. A 49-year-old presents with a history of painless discharge, hearing loss and fullness in the left ear. CT shows a soft tissue mass in the middle ear with intact jugular fossa. Coronal reconstructions show erosion of the epitympanic ossicular chain with intact scutum. MI shows that the soft tissue mass is high pointance on T1 and intermediate signal on T2 with no enhancement with gadolinium. The most likely diagnosis is A. Secondary cholesteatoma. B. 14. A. Secondary cholesteatoma. Definitive diagnosis of cholesteatoma requires CT evidence of bone erosion. 15. A 70-year-old male with a low score on the Glasgow Coma scale is admitted to a medical assessment unit. MI shows a large area in the left MCA distribution returning high signal on diffusion weighted images and low signal in the corresponding area on the ADC map. The most likely diagnosis is A. Acute cerebral infarct. B. Old cerebral infarct. 15. A. Acute cerebral infarct. In the acute stage, the CT scan may be normal. On MI, diffusion weighted images show bright signal and low signal on the ADC map. The signal on diffusion weighted images increased during the first week and 16. A 27-year-old woman presents to the accident and emergency department with headaches. A CT scan of the head shows widely spaced lateral ventricles, dilatation of the trigons and occipital horns of lateral ventricles with an upward displacement of the dilated third ventricle. The underlying abnormality in the brain is A. Midline arachnoid cyst. B. Agenesis of the corpus callosum. C. Prominent cavum septum pellucidum. D. Hydrocephalus. E. Lobar holoprosencephaly. And decreases thereafter, but the signal remains hyperintense for a long time. The ADC values decline rapidly after onset of ischemia and subsequently increase with the flip-flop from dark to bright 7-10 days later. 16. B. Agenesis of corpus callosum. This is associated with parallel, widely spaced lateral ventricles that may appear crescent-shaped. There is dilatation of trigons and the occipital horn of lateral ventricles, along with a high-riding third ventricle. Callosal agenesis is associated with Dandy-Walker syndrome, Chiari malformations and fetal alcohol syndrome.